It's now 6:04, so I'm going to call the meeting to order of the Mendocino Coast Healthcare District Board of Directors. Thank you for all your attendance, both online and those of you in the room this evening. We need to begin with roll call. Madam Secretary, would you call the roll?
Sure. Okay, Mr. Garza.
Present.
Okay. And I keep wanting to call Lee Finney, I'm sorry. Paul Katzef.
Here.
And Susan Savage here. And Sarah Spring.
Present.
Okay, thank you. We have a full board of four. We still have that vacancy. I see that former director and chair Finney is joining us tonight by Zoom. We kind of wish you could be here with us, but anyway, we understand. Okay, let's begin with. First of all, before we even begin, I'd just like to make a quick observation that we know that spring is here now. And how do we know that spring has begun? What was today?
Opening day.
Opening day.
Baseball. Right. Yeah.
Baseball, yes. My team did really well. I think most of you up here, your team didn't do so well, but that could change. Just remember, it's 162 or 161 more games to play.
And this is maybe off of your radar screen, but I want you to know, when the San Francisco Giants played the Sacramento Rivercats, the Rivercats won substantially.
That's
Go
not
Rivercats.
something to really,
Yes, it is. Yes, it is. It's the home team.
That's embarrassing for the Giants.
No, it's not.
It
No,
wasn't
it's
good
not.
for-
They're in a building year, but Pablo Sandoval came on and hit a single, and it was very.
And I will observe that I am, from your point of view, regrettably, from my point of view, just fine, a diehard Dodger fan. But I'm cheered by the fact that the Giants appear to be a much better team this year, and it will be fun to watch that rivalry. It'll be really much fun. Okay, with that, the entertainment's over. I'll call for public comments. Mr. McDonald.
I sent the board members a email about this, so I'm going to kind of do the quick version of it. On the district's website, under board meetings for both regular and special meetings, all of the video recordings or links to the video recordings, except one from September, are missing for 2023. So far this year, there have been several meetings when you add the special ones to the regular ones, and all of those links to recordings are missing. I would think that this is something that, since we have the agreement, this has occurred since the agreement with RGS, I would think that that's something that the agency administrator or somebody else at RGS could at least oversee. It's been going on for at least 2 weeks that I noticed. I didn't notice it until about 2 weeks ago when I looked back for, I think, one of the December meeting recordings. So to me, it's another failure from RGS and the agency administrator. In that same vein, if you look at the agenda that was printed on the website and some of the attachments or tabs to the agenda, at the bottom of each page, the name Regional Government Services appears. This is a misrepresentation. All that should appear is Mendocino Coast Healthcare District. It confuses the public. It's just not the way things should be done. We went through something like this in the past when one board member took over the website for the district, and we had different headings for things, and it was obviously, the website of that one particular board member. Again, so RGS needs to get on top of that. I waited on this, although I sent a message to Ms. Wiley back, I think, in the end of January. I don't feel that it's appropriate, and it certainly hasn't been the practice at this district for a board member or an employee to be writing their college degree after their name almost every time it appears on an agenda. To me, I don't think you have to be the son of a psychiatric social worker to figure out that there's some ego issues going on there when that continues meeting after meeting after meeting. That needs to be taken off. I've heard this, it's not just me, I've heard it in more street talk parlance that at best could be called sort of street humor references to that. It doesn't reflect well for the district, the board. So that needs to get changed. Once again, this agenda does not contain an item designated for public comments on the consent calendar. In effect, that failure nullifies the board's ability to take action on the consent calendar. Once again, we don't have a public comment section at or near the end of the agenda, which has been a long-standing practice going back many years. Considering the seeming, air of transparency or desire to have transparency, those two things collide to me. March 4th of last year, I filed a public records request. A small portion of that was complied with, I think, in October. The remainder of it, I've not heard about. Again, I don't know whether we throw this at the board secretary, at legal counsel, at RGS, but, a year and 3.5 weeks later, that's not on the level of competency.
May I ask a question? Because I have a question about something that he said that I'd like to follow up.
All right, normally we
Okay,
don't.
I'm interested in, you said that the recordings are missing for many of them for 2023, but they were up at one time, but now they're gone.
I think we emailed about one of the meetings late last year, and then that got worked out. And
Yeah.
they were
because-
all up at some point. I actually have a few that I
Yeah.
downloaded myself. That's how I know they
Okay, well,
existed.
thank you for the heads up, and
Okay.
I'll check and see what happened.
Director Savage will refer you to Government Code 54953.5, item B. Okay, shall I read it?
I hope you're not going to reference it.
Okay, once you're out of order. This is a conversation now with the board. You're not been recognized.
Okay.
Okay, you want me to read it?
Calm down.
What is it that we're talking about? I'm not sure.
This is the section of code that talks about audio and video recordings of meetings.
Well, I believe that
okay.
we're required to, I know personally, every single one of those videos were posted on the website.
That's
And my
correct.
concern is if it's something, and because Streamline is weird sometimes, somehow something that was being changed and adjusted, those videos went down. And I still have them and
Okay.
could put all of them back up. That's not a problem, but I appreciated the heads up if things were missing.
Let's go on. This
No,
is
I have a question for you.
Okay,
That's
question.
separate. I wanted to discuss the agenda if possible. Remember, we talked, and there's nowhere on here to discuss the actual agenda.
Yeah, it's inappropriate to be adopting an agenda, okay?
No,
This
but
is
I
the
want to
agenda
talk
that's
about the
published.
delivery of it.
Oh, okay, what's the delivery of it?
I have to say that the way that it's been coming to us is confusing. And
Okay, can we talk about this further on when we get into reports, rather than?
well, can you
we've
tell
got-
me
we've
where?
got- We've got some business, but we'll get to it, okay? Okay, can we defer that?
Public comment on it.
Yeah, Mr. Maroney? Let me,
Gabriel Quinn Maroney, good evening and thank you. I have a few things on my radar. I recently had a family member pass away, our beautiful dog Macy. And so I just kind of want to mention that I didn't really know till we really need the veterinary services in a certain way that it is challenging around here. Lots of times people have to go to Santa Rosa and beyond. And so just kind of adjacent to what happens with the healthcare district, I think having veterinary services somewhere in our consciousness is a good thing because it affects our health. They are family members. So I think that's pretty important. And also, when it comes to medicine in general, I think we get the, you know, getting good medicine, but also progressing the medicine, it's important to have like clinical trials. So this idea of having a school here or somehow where we're conducting clinical trials to also push forward, you know, medicine as much as we can, and advancement is very important. Another thing, I was talking to a friend, and he mentioned he went to a dermatologist, and the dermatologist was kind of like, oh, well, I'm not familiar with black skin. And so,
I'm sorry,
I'm not familiar with
black skin or darker skin.
okay.
And so, you know, again, just something to be, you know, on our radar, like, you know, maybe training for, I'm not sure how that would manifest in different versions, so, and I think that's important. So those are just my comments.
Okay.
Thank you very much.
Thank you. Thank you. Any more comments at this point? Okay, then it's always a privilege to recognize Ms. Leach, who give us a report this evening.
And here we go. It's all good. It's all good. Well, good evening, Board. Thank you so much for allowing us to give you a quick update from Adventist Health Mendocino Coast. I realize that your work is far beyond just the focus of the hospital. As a healthcare district, your responsibilities include everything, as even just asked about, to make sure that health is defined differently. And I want to say thank you to Mr. Katzif, because you continually bring us back to the fact that it's about care. It's about well care as much as it is about acute care. And so as you've expanded in your horizons of defining your work, part of the work that Adventist Health does is in that space of well-being. I'm very pleased to let you know that the Blue Zone work continues to thrive in Mendocino County. And our focus right now happens to be on access to food. It is on the areas of drug prevention and reducing the use of tobacco. Those are criteria that were not defined by Blue Zones or Adventist Health, but by the County of Mendocino when we asked them, and over 340,000 people responded to those surveys 3 years ago, to say, what is it that you would like to define as being a healthy community? And it was helping make the healthy choice the easy choice. Dr. William Miller told us recently that the average age of a patient here in our hospital is 76 years of age. When you compare that to what happens in other hospitals in Lake and Mendocino County, that tells us that the age of those that we care for here at the coast is substantially higher. People are living longer at the coast. They've chosen this as their place to live and to thrive and to make, again, the healthy choice the easy choice. Meanwhile, the hospital is looking at how do we focus on prevention of disease as much as we do on the care of those that need acute care. One of those areas that happens is in our clinics. So I'm very pleased to let you know last year, now that all the data is in, and we're going to rely on data versus hearsay, now that all the data is in, over 37,500 patient visits were provided here on the Mendocino coast in our clinics. That doesn't mean those patient visits were for people that had illnesses only. Those included the work that we do in the areas of prevention. And so a lot of those are well checks, which allows us to say, here's a pathway for you to make, again, the healthy choice, the easy choice. And I'm very pleased that our physicians continue to look at the pathways of care differently than just in an acute care model. Meanwhile, our emergency department last year saw over 10,000 patient visits. You might be interested to know what's our census, and I will tell you that the average daily census this past year has been at 15.8. So why do all of these numbers matter? They matter because you're making some decisions on what the future looks like, and I think it's important to have that data available for you. Again, over 10,000 patient visits through the emergency department, nearly 38,000 visits through our clinic system, and an average daily census of 15.8 for inpatient care. We know that society is moving more now for looking at outpatient services, and again, here at the coast, as we continue to try to keep people well rather than just respond to illness, it's the opportunity to deliver medicine differently than we have before. It's also the most challenging time in healthcare, and I will be very transparent with you by telling you that delivering healthcare now is probably the most complicated it has been in decades. Those that lead this work, including our friends at Providence, at Sutter, at Kaiser, and others, we all meet together on a regular basis. Last month, I had the privilege of serving on the California Hospital Association for Rural Hospitals in their national conference, where, and they call it national because they bring in people from other states to what California is talking about. I learned that we're really not all that special here on the coast. We think that some of the issues that we're dealing with are just about our remoteness and our rural space. But after listening to the 37 hospitals in that conference last month, I learned that there is a lot in common, regardless of health system or district hospital or independent facility, because reimbursement has gone down substantially. So when you evaluate the reimbursements that hospitals are getting today, the cost of delivering care, and the volumes that we're grappling with, I will tell you it's a fine line that we walk. I want to say thank you for walking that line with us as a healthcare district, knowing that the hospital is one of the things we look at. By the way, seismic was another topic that was brought up during this conference last month. Once again, the people at the table were the 37 hospitals that are impacted from a rural standpoint in it, and some of those hospitals are very clear that their future will no longer exist in those communities if the legislation that is put in front of them continues as it is. It's just not a viable option. You've heard the news about Madera, you've heard the news about what's happening in San Luis Obispo. Tenet Healthcare, who I think is one of the most respected national healthcare companies in the country, has had hospitals here in the state of California. And they have made a decision to exit that, and they're going to put more of their energy in clinics and in freestanding surgery centers. I just thought it would be helpful to bring that up to you because I know that our communities that you as a healthcare district are always interested to know what the hospital side of the story is as well. So I'm going to pause and ask if there's any questions I can answer.
Yeah, does the board members have any questions at this point?
Yeah. You mentioned that you were focusing on 3 areas of wellness, but you didn't say, you didn't tell us what activities those were. The categories were clear, but how you were doing it was not mentioned. I'd be interested in knowing exactly what it looks like, what it feels like, how much energy is being put into it, what kind of staff you have, what kind of training these various healthcare workers who are applying their skills have. What is the commitment? The commitment can be mental and emotional, but it's all about practice, putting it into practice. And so I'm asking you to give us some examples, or give the community some examples of what you are alluding to.
Thank you. That's a great question. One example is, and again, this is the work of Blue Zones. So Blue Zones is a separate branch from the hospital portion of care that's being delivered. The team from Blue Zones was here in Fort Bragg a couple of months ago. They were at the town hall, is that what we call it, the town center? And members of our community were there that day to talk about what does creating a healthy community look like. And so the feedback from the community was really essential. We held sessions here in Fort Bragg. We also did inland in Ukiah. There was one in Willits, and so people could choose whatever location was best for them. Here in Fort Bragg, the conversation was, what does a healthy community look like? And they brought forward examples from other parts of the country. Again, we are in, I want to say 76 different communities across this country right now with blue zones. And that meant creating healthier neighborhoods. So that meant an infrastructure for a city would look very different with more walkability. We're very, very blessed here on the coast to have these great trails. But even if you looked at the downtown area, to where people would be reducing their utilization of automobiles. And how do we do that with our parks, with our resources to make more walkable communities? Our challenge in this county, as we all know, is the geographic spread and the rural spaces between us. But we're looking at where are those concentrated levels of population zones, thus Ukiah, Willits, and Fort Bragg. And so what are the things that we can do to have more walkable streets? What would it be like to have sidewalks in appropriate places, or bike lanes that would make it safer for those utilizing those services? How can we make choosing the healthy food the easy choice when they're at the supermarkets? And so Blue Zones is working very closely with Harvest and will also with Safeway. And those are choices that we have to, how do we not stock those areas near a cash register, with all those things that we may love to grab, to munch on, and it might elevate our sugar levels. So how do we create the easy choice to be some of those healthier options? And that's the work that we're doing with local businesses. Also restaurants. So now there are some Blue Zone certified restaurants here on the coast. That's thanks because these companies have come forward and said, we want to provide Blue Zone recipes for our communities so that we have, we're blessed. We have really great food here on the coast, right? And we have community gardens here. But not everybody has leaned into that as well. We are very blessed that on Wednesdays we have our market in the city center, and Mendocino does on Friday for our farmers markets. But how do we make all of that a little bit more accessible to people so that they may not have to go a distance? How do we make community gardens thrive in a community like this? Those are a few of the things that Blue Zones is doing right now.
Can I follow with one other question?
All right.
I know you're looking at the time. We'll get out of here by 10 o'clock tonight, don't worry. Back in the 60s, which was a long time ago, a different approach to organizing community were the mode. Community workers, not healthcare workers, because this is a new thing. But so here we have Westport, Cleone, Fort Bragg, Casper, just go down the list. And each one of those are communities that are not city of Fort Bragg or Willits or Ukiah. And it's where people actually identify as home. Wouldn't it seem plausible for the healthcare district, I'm not saying the hospital, but for the healthcare district to have outreach workers in each community? Would you agree with that?
I would agree with that.
Okay.
The country is moving more and more to community workers who address social determinants of health. And if we address social determinants of health, it creates a much healthier environment for everybody. So I would be very, very supportive for the district to look at how to do that. And it does require partnerships from many entities. we'd be happy to be at the table to talk about that.
Thank you so much. I will
Okay.
call upon you when I am ready to present an idea to this board.
Thank you.
Is it ready? Okay. We move on now to my
Sure.
chair's report.
Chair Garza, could I just mention something? Judy Leach last week was named by Becker's Health, which is one of the industry standard publications for healthcare industry. She was named one of the top 110 rural hospital and health system CEOs to know. A pretty great national distinction. So congratulations, Judy.
Congratulations.
Yeah, that's going to be good support for me and my ideas.
Okay, let me move on to the chair's report now. It's a report to be received, and it's received, the board have asked their questions, and we move on. We're now going to do. You're out of order again.
Come on.
We might actually have something useful. Be a
I'm-
leader, not a reactor.
I'm going to move on to my chair's report. Okay, I have for you in the agenda package, if you just, a remarkable report that just came out from Deloitte. It's one of the things that got shared with me. It's talking about, and it has implications for Director Katzoff's favorite theme on blue ocean, excuse me,
You're involved.
blue zones. As well as what Ms. Leach was talking about. There's undergoing a major shift in the delivery of healthcare services right now. I encourage you to take a look at it. It's both exciting and scary at the same time, like most of these things are. There's a movement from away from the traditional model that we're all pretty much familiar with to a very much consumer-oriented practice of medicine, with a heavy emphasis on new artificial intelligence, and they're predicting some trends that will take place over the next few years, coming pretty fast. That's going to really reshape the system. They're, like most people who write these reports, they're seeing it as very optimistic. I'm sure there will be some positives, but there will also be some things that will not. Will become difficult as well. But take a look at it as much as possible. We will try to keep the public informed on any kind of major issues that we become aware of. Okay. Secondly, I'd like to announce tonight that we have currently 5 dates that are viable for the community forum. We have discussed just briefly that we'll be bringing down the California Center for Rural Policy to present their research. And Mr. Ramos, Mr. Katzoff, and I believe Ms. Savage, Director Savage? Yep. Are working together to put that event together, along with the community, other members of the Community Foundation. And excuse me, what's the name of the?
CMAR,
What?
Coastal Mendocino Association of Realtors.
Okay, and they're willing to fund all of our costs. Fortunately, we're getting the speaker, the keynote speaker at no cost. So anyway, that's, I just want to get some good news. Okay, board members have any questions for me? Okay, seeing done, Director Savage, Finance Report, Finance Committee, excuse me.
Okay, well,
Oh, I'm sorry, did I say Director Savage? Director Spring? What am I?
yeah, I was gonna say,
My apologies, I don't know, I looked that way, I'm sorry. Director Spring, it's your committee.
Well, thank you, Kathy, for having the minutes attached. I think that it was a productive meeting for Susan and I to work through questions and procedure, and I feel like we got a lot of input from the community. I'm sorry that the budget that I presented did not make the packet, but I'm hoping to have a more complete package next month, and I think we're getting there. Paul Garza and I have been talking about what he feels needs to be there, and we're working all of that out. But I appreciate the public that was there. If anybody knows of anybody that would like to be on the finance committee, please let me know. My information is on the website, and we are looking for public members.
Okay, thank you.
And just
You have a,
for the record, there's a couple of corrections on those minutes.
Okay.
One of them is that Gabriel was there. Am I correct? Yes. Whose name needs to be added. And then also, because I'm not the one who was taking minutes for this meeting, and Kathy was, so her name should be the one who signs the minutes. If she's the one that takes them. I mean, I don't mind taking the minutes and reporting them, but these aren't mine. So it would be better that you get the credit.
I don't think that's, I don't think that's a correct procedure. I think the secretary has to approve those minutes before they can come to the board, but we'll check, okay? We'll check.
Possible, but then if I'm going to have my name on them, then I'm just saying, I would
As the-
prefer that I'm taking the minutes.
Well, yeah, I think the point is that you've certified that those minutes are correct. And that's whoever takes them, but, okay. But okay. Okay.
We'll find out.
Yeah, sure. Okay, Ms. Wiley, your report?
Oh,
Linda Williams' hand is up.
There's a hand up.
We're not,
Not there.
Okay.
this is reports only. This is information only. We will move into the finances later on in the agenda. Okay.
thank you. So I added a administrative report to your packet and put it online this afternoon. I wanted to mention that we had a community meeting in Westport last night, on Tuesday night, with Fire Chief Dan Maxey, who highlighted some important immediate medical response needs, and the fact that all of the responses are handled by volunteers in that district. He explained a lot about the geography of the district and the fact that it takes an hour and a half from the fire station to get to Usaw if someone has a medical emergency, and that there's no connectivity for most of the area between Usaw and the fire station. And we talked about ways that the district might finance some needs of that department and other other volunteer departments, like remote handheld devices, maybe even something like writing a grant or trying to somehow figure out how to get a repeater up there. He mentioned that even the CHP radios don't work in that area, so they have to get to the first responder in order to contact the universe. So I think everyone that was there, and thank you, Gabriel, for showing up, would be in agreement that the rural Westport Fire Department faces a lot of challenges, not the least of which is finding volunteers to serve. And Chief Maxey does all of the work of the fire chief at no pay. And I think, I speak for all of us, that we were pretty impressed with what he does with the small resources that he has available to him. I did want to also call your attention that we have 3 more scheduled community meetings in Fort Bragg and Casper. April 2nd is an English-speaking version at Town Hall. April 4th is the Spanish version, and the LATCO group will be helping us by facilitating that and giving us written minutes of that meeting too. And then Wednesday, April 10th at Casper Community Center, and those are all at 6 o'clock, and press releases, et cetera, have gone out. We're encouraging community members to come talk to the board members and let us know what healthcare looks like for your family. Just reporting that the 515 Cypress Drive emergency re-roof project is completed now, and I've set up a district account for Sourcewell. Sourcewell is a procurement company that will help us put out requests for work under the public contracting laws, and it will help us with competitive solicitation so that we can get the best deals. And they do work with local contractors, so it's not like we're outsourcing it to some unknown company. They try and work as much as they can with local. So as we go on to facilities projects, then Sourcewell is in place and can help us out. I wanted to remind folks that the board has 1 vacancy, and we've been advertising to the public, And we hope that applicants would send email to the board chair by April 17th.
Let me, because there's been some, gotten some emails, but I still have not received people sending a letter of intent and a resume, so let's make sure we continue to specify that we have always requested a full package, and all we're getting is statements saying, gee, I'm interested, and so people need to follow through if they're serious, so that the board can make a good, strong deliberation on who our candidates are.
Thank you. And I wanted to report that Dan Davies of the Wildan Financial Services Company has issued a report to BNY Mellon, our bondholder, and I've attached his report to the back of my my admin report. And I'll go through just a couple of highlights there in just a second. And then finally, I wanted to let you know I've been working to obtain the .gov domain name for the district. 2025, we have to use the .gov suffix, sorry. And I've applied for that, so the domain will be mchcd.gov, and that will also be the email address, so it would be info@mchcd.gov, and those are required as of January 2025. So finally,
That's a legal requirement.
it is, yes. And then finally, on the annual continuing disclosure information statement at the back of my report, you'll note that the bond issuance, the balance as of February 28th, 2024 is $3,600,000. And it describes in this report the what the district has done financially, and also what the makeup of the district is. Approximately 680 square miles, describes the district itself. And then one other piece of information I thought was interesting is we do have budget reports going from 2014 to 2019, and he's written this report saying that the financial statements that we owe will be forthcoming to our bondholder. And I just thought it was sort of interesting. It's page 5 of the report. The largest property owners are listed with assessed 23-24 secured value. So you'll note that we aren't really at the top of the list at all, but Mendocino Redwood Company is the highest secured property taxpayer for this fiscal 23-24 year. So I just thought that chart was interesting to look at, and I'm happy to take any questions.
Okay, so
Director Savage.
The document that you're talking about was posted later on today? That's not what's in the packet, or?
My admin report, yes, this was all part of my admin report that was posted today.
Well, it was posted today, but it's not,
Correct.
because I was digging through trying to find it.
Yeah, it's in this handout.
It's in this that we got.
Back
Got
it
it,
up.
got it, okay. I get it, thank you.
Sure.
Okay.
And
Any
then
other
the
questions?
The
Oh,
other
sorry.
question I had, Sourcewell.
Yes.
What do they do? Is that a cost for that? There's a
No.
percentage that they take? How does that work?
There is not a cost. They help us, their business model is to help districts and government entities source projects. It's not just building construction, and I can give you the website and fill you in on the details about that.
But there isn't a charge specifically to them on top of the cost of?
There would, no.
Okay, Director Spring.
Is that like buy board?
I don't know by board. I don't know.
I'll send you the information because they were at the annual conference, and it sounds like it's the same sort of thing. You buy at a bulk discount because it's a government.
Because it's government, yeah, bulk buying.
Yes.
It's similar from what I understand. And I had, since we didn't run the roofing project through them, I'm still trying to figure out exactly how that works.
But the good news is that the roofing project is completed. It was well done. A lot of work was gone into it. Director Spring put quite a bit of effort into it, and I know that Mr. Johnston had a lot of work into that, and we're glad that we got a good result on that. That's good for everybody in our community. Okay, any more questions for Ms. Wiley? Okay, moving on, consent calendar. You have the consent calendar before you. Is there anything that the board there wants, board members want to pull?
Do I have to address the consent calendar, or can I just speak as a board member?
I'm sorry?
Generally, there's a moment in the beginning of the meeting when the board members can speak.
We have that at the end, okay?
Not good enough. Why was it changed?
Because we have the board has an opportunity to speak throughout, and then the board has final comments at the end, so that they can then project those kinds of things that we need to be looking at as the future.
You see, I look at it a little bit differently. I look at it that a board member should have the opportunity to set a mood in the beginning, rather than just react to everything that happened in the end. I feel like
okay. I
we've
hope you-
made a decision that I was not part of, that's for sure.
Okay. Consent calendar, any Director Spring?
Can we pull the record retention policy, because I have questions about it?
Okay. Anything else? All right, so can we approve the consent calendar, and then at this point, I need a motion, and then we will move on to the record retention policy as an isolated.
So point of
Director.
clarification, what's left on the consent calendar is the minutes from February 29th, is that correct?
I'm sorry, what?
Correct.
Two sets of minutes, though. So it'd be
Yes.
4A
Got
as a
it.
whole.
Right. The regular meeting and the special.
Correct.
But that's,
Right.
the minutes is all that's left on consent.
Right.
is that
Correct.
Okay.
Correct.
I make a motion to approve 4A on the consent calendar.
Okay. Okay, is there a second?
Okay, and I'll second.
Okay, any comments? Okay, all in favor, say aye. Oh, roll call, I'm sorry.
Okay. Paul Katzif.
I abstain.
You can't take an action without calling for public comment.
Yeah, let's continue with our meeting, please, okay?
You're going to invalidate the action.
Can you,
Okay, all in, will you call the roll, please?
Okay, Susan, yes. Sarah?
I would like you to explain the change, because I was told that you can't take an action without going to public, and so I don't want to be
Now,
part
it's,
of.
the consent calendar is different. It's a consent calendar. Believe me, I've spent a lot of time with our attorneys and with RGS in consultation over our agenda. We're cleaning this up to make it as efficient as possible.
So I think you're making decisions that are the full boards and not informing us of all of this,
Well,
like
I-
Paul just brought up. And I don't know that I feel comfortable with you making unilateral decisions for the rest of us.
Chair Garza, Norma has her hand up.
Who, I'm sorry?
Norma?
No, she does not.
No, that's the.
That's the
computer.
mouse.
Norma?
I'm sorry.
Norma, do you have a comment?
So I understand the concerns that are appearing tonight about public comment. There can be an opportunity for the public to ask for an item to be pulled off the consent. Normally that can be done during the public comment time. If that is not provided during that time, it is prudent, it is good to have an opportunity to ask the public, is there an agenda item, a consent agenda item that wants to be pulled, and you can consider it under separate consideration, like we did last meeting. The chair is right that practice, if the attorney, our attorney here, MCHCD's attorney has said, hey, our practice and precedents, I can't speak on precedents, I haven't been here, to know if approving the consent calendar without that has been what we've done and what he has advised. But it is common that a consent calendar's purpose is to approve an action one time, everything at one, with one motion. That's my understanding of what is in question right now. Am I understanding that correctly?
Somebody has to answer.
My
Yeah, as far
question
as
is
I know.
going to public.
For public comment?
No. If there's an action, not just general public comment, but comment to the consent calendar.
So I go back to the opportunity, Chair. What was it that your attorney advised you regarding that matter? Because I wasn't present during that. I haven't been here long enough to know what we've done previously. So what has been the previous action of this board regarding that, and what has the attorney advised?
Our attorney has advised us that consent calendar items are, there's no public comment on.
Okay. And that is very common. There should be an opportunity, like for example, item 4B was asked to be pulled, right? So that item, when it gets pulled and it is going to be considered separately, that opens it up to removal of the consent calendar. Therefore, there would be comment for that one. But under consent items, you move along, it's consent, it's action of regular business, regular meeting, or regular matters of the board. You vote on, you make the motion, you vote, you move to the regular calendar where public comment is at.
The consent calendar stands for those things that we approve, but if we pull an item, then it becomes a separate one, and then we have public comment. Is that
Right,
correct?
'cause you're pulling it
Okay.
to consider it as a regular, on here, it would go like under a 5, right?
Okay.
A regular calendar, you follow under that.
Okay.
I
Okay,
do think that, again, I can't speak on precedents, but what I believe is the kind of the best course of action for getting your public involved. The point of the Brown Act is you want your public to be involved, right? You want an open, transparent opportunity, is that you ask the public if there are any matters that they want to address in the consent calendar, and you give that opportunity, but you aren't required to, is what our attorney is advising. So,
Okay, thank you for that clarification. That's very helpful. We want to, we'll try, we will not allow comments from the seats. If you want to, if you need to be recognized, you need to stand.
Of course, you need to be corrected, sir.
I'm going to, okay, I'm going to reset, I'm going to call a recess, a 10-minute recess at this point. We'll come back at 7 o'clock. Directors,
I
we're,
just wanna
we're,
make sure, Norma. that-
we have a motion on the floor in a second. Yep.
Can you repeat what you said again?
Okay. It's now 6:58, and I'm calling the meeting back to order just a little bit early. We have a motion on the floor, and Director Savage, can we complete the motion, or
Okay,
the
the
vote on the
motion on the
motion?
floor is to approve the consent calendar, which at this point includes only the minutes of the 2 meetings that happened on February 29th. And so far, we were partway through the roll. Mr. Katzif abstained, correct?
Correct.
And then I voted yes. Sarah?
Abstain.
Oh, my God.
And Paul Garza?
Yes.
Yes. So since we only have 2, that means that the motion fails?
I want to change
Am
my
I
vote.
correct?
I'll change my vote.
Okay.
Is there a procedure that anybody is upset about if I change my vote?
No.
Will I-
No.
Okay. Just checking, folks. I'll vote yes.
Okay, thank you.
Okay.
So the minutes are approved.
Okay, minutes are approved. Now let's
And
go
for
on.
the record, we, thank you very much, Treasurer, Vice Chair, right? Vice Chair Petzoff. But I do need for the minutes, if someone's going to abstain, you need to state your abstention, why you're abstaining. So, Treasurer,
You want to know why I
No,
abstained?
it's.
no,
Why
not
I
you. You
abstain.
changed yours to yes, so I was
No.
saying thank you. So I need to have why, Sarah, Treasurer Spring, why did you abstain? What's your declaration for that?
Who is that?
My hesitation is because it's an action item, and I thought we needed to go to public, so I'm not gonna put my neck out there.
Okay, thank you.
Okay, fine.
It will be noted in the record.
Okay, let's go on now to item 4B, which is the records retention policy that we have reviewed now twice. This is the 3rd time. Board questions, comments on that, concerns?
Can we go to Appendix B, please?
I would comment that this was the item that the board requested to be reviewed by our attorney.
Keep going.
We have had the attorney review it,
Okay.
and he has approved it as it stands. But
I find the retention periods confusing for our specific entity. And my fear is that if we lose part of this, which I know Kathy pointed out in the beginning when the front pages were missing, it just doesn't make sense with just the grid. For us. I could see for somebody else who has these different things. So, is there a different way to do this that's not as cumbersome?
well, that's, is there?
If I may, Chair, this was the CSDA model policy.
I
lifted
understand, but
straight. And
all
I'm-
those policies are meant to adapt to your own entity.
Sure. What suggestions, if I might, what would you change?
Well, because we don't have a record center at this and I don't foresee us having one in the near future, I would say that the office would have the retention periods of the retention center.
But retention center, and I'm looking at Appendix B, and you're talking about, there's office record center, and then there's retain or destroy. And so you're concerned about the middle period there, the record center?
I'm saying the middle period would move over to the office column.
Oh. Okay,
Or we would do the retain or destroy over to the office column and not have the other 2 columns. Because the gist of it is that we don't want to get rid of these things. For instance, if you go down to number 5, we need to keep them for 12 years. So
Correct.
because we don't have the other two applying to us, I feel like the safer policy would be to move the retainer destroy column on all of them over to office and do away with the two other columns.
Okay. Is there, Director Savage, is that acceptable to you?
Oh, very, very. And I had another thought, depending on, because I thought something Sarah just said was also important about the possibility of various parts of this document being separated from each other. Was there a reason why this particular table had to be set up as an appendix to the document rather than placed in policy number 7? So
Well,
at the conclusion of Article 6, then records and retention summary, have it in there so that there isn't a problem with those two documents being separated from each other.
That would be a good question for CSDA, whom we relied upon to give us a model policy. So I don't know that we can answer that. I do think that's important that at some point we adopt a clear records retention policy. I think if we want to be more conservative, I think that makes a great deal of sense. I don't think there's any objection, but I don't know. We could ask CSDA why they did it that way, but if you want to somehow bind it, as rearrange it somehow, I think we can certainly do that. That's certainly very appropriate.
Can I
Director
Can I
Springs.
attempt a
Please.
motion?
Yes, please.
So I would like to make a motion to attempt to approve policy number 7 with changing Appendix B, column retainer destroy to where office currently is, and do away with record center and retainer destroy.
So Chair, may I speak?
Yes, please.
Sorry. I love how Treasurer Spring is looking at this. And I do agree that as a joint power authority, you do have the opportunity to make this your own. It is a recommendation, a standard template, a standard kind of boilerplate that was obtained from CSDA. Then at that point, you look at your own organization and you make it your own. I do want to point out that there is a reason that these 3 columns are designed the way that they are designed. As I'm doing a major overhaul on a retention schedule for another agency, how I describe this to them is there's a life cycle of a record. The life cycle of the record could be, for example, and Treasurer Spring, I'm going to use you as an example. You create and develop the budget, right? As a treasurer, the budget is worked through you. You're producing that record. You have that in your office. Your office is where you are producing and working that record. You have that record sitting there for the 2 years. You transfer it to a record center. Record center doesn't have to mean something way off site. A record center could mean the closet sitting right there at your district office. That's your record center. That's your archives. The location that you are settling that record as an inactive record for the remainder of the term of that retention. It helps understand that life cycle. It's written for the life cycle. So it actually is written very well. It is designed exactly how we as records geeks, record people, lay out the life cycle of a record. You are more than welcome to make that amendment, absolutely, but I just want to give explanation, and hopefully that helps Treasurer Spring understand a little bit of why it was laid out the way it's laid out. And so then number 2, we already have a motion on the floor. That motion was made at the previous meeting. When this item got postponed, that motion was placed on the table, moved now here. So if there are any changes that are to be made, you're making a motion to amend that main motion. And that main motion made on the, in February 29th, it's in the minutes. It was made by Savage and Garza to approve the policy. So just to let you know, we do have a motion on the floor. It's a blanket approve the policy, which would approve all the appendixes. And so you are welcome to make a motion to amend in whatever fashion and form you want to do.
Okay.
Right.
So,
Also, to address that, why is there appendixes versus the policy? That's standard, very, very standard way of writing, like code and policies and, resolutions, is you have your language, your standard meat and bones in the policy itself. The things that you're going to be massaging and you're going to be possibly reviewing and looking at again in the future, so like your appendixes, you're going to put them as an exhibit or appendix, right? Like your conflict of interest code, things like that, you have your code. This is the language, these are the rules, this is what you're following. Your designated filers, that's something you have to look at every 2 years. That's an exhibit or an appendix. This is following that same kind of legalese language for legislation. So it's just a boilerplate process template and trying to address Secretary Savage's question about why are these appendixes not written in. It allows you more freedom and flexibility for future amendments to amend the appendix versus the entire document, for its entirety. So preference to one thing or another, just trying to explain that.
okay, is that helpful at all, or?
I,
So now it's, if I understand correctly now, you're actually requesting an amendment to the
Yes.
standing motion.
correct,
Okay, and that is to take a record center and retain or destroy and move them into office?
correct.
Well, that would mean that
And then
we-
you would just sorry, I said it incorrectly.
Okay.
Move, retain, or destroy to where office is and get rid of office and
So
record
there
center.
would be one column,
So there is only one column.
correct?
And I understand why it was set up like this, but I feel like it's cumbersome for our entity. And the whole point of CSDA's policies
Yeah,
are to
yeah.
make them to your organization.
Yeah, no, I think that's a very appropriate comment.
Okay,
What I'm
and I'd
not
like to
understanding
second the
is that
motion.
if, I guess what, the implications of that, if we do that, does that mean that, for instance, we have records affecting property or titles thereof, office 2 years. If we remove that office, then I'm lost. Please, I'm sorry, and maybe just my confusion, please describe it again.
Okay, so
I'm sorry.
maybe if I visually show you,
Yeah,
take these two columns, get rid of them,
okay.
and move this there, so that it's the only one in retention periods.
Okay, got it. Okay, so, is that clear to all the other board members and to the public?
And can I
Yes,
speak to
please.
it? Because I think I said I would like to second it. So if I understand it correctly then, because the only column we would have and the only directive would be to retain or destroy, but it would be the flexibility of where physically things would go. Do we have to designate in policy, whether it's in the office or this closet, record center, whatever, but that isn't, in my mind anyway, integral to the policy. What's important is we're retaining, we're destroying. And you have the flexibility according to this definition, may be destroyed if stored in electronic media.
Okay. So,
That
Which
makes
that would
sense to me.
stay.
yeah, okay. Okay, so, yeah. All right.
And I'd also like to say, because I've worked a lot with various boilerplate languages, and the whole intent of the boilerplate is for you to customize to make it fit to what your, if I could finish, if you make it, you customize it to make it fit to the particular needs of your organization, and many of the policies that we've looked at as boilerplate needed to be modified because they don't match what it is that we do. So I'm not particularly wedded to the format just because the Special District Association uses it for a multitude of entities that may be very, very different than ours, that kind of a change seems to make sense.
Okay.
And I'll withdraw my other comment about simplifying it further to not have a separate appendix, because I don't think that that's crucial, unless anybody else is feeling the worry about having appendices somehow get separated from the
Okay.
policy.
I'm just trying to make sure I understand it, and I do understand that we are free to do with this what we feel we need to do, okay? So I'm not trying to restrict that, I'm just trying to understand, okay?
Okay.
So, okay, so we have the motion to amend the Appendix B and remove Record Center, okay, I'm still,
Removing office and record center.
okay, Office and
those
Record
columns.
And
Center.
replace with one column for retain.
Replace with one column.
Or destroy.
Okay, great. Okay, public comment now, because this is now open. Mr. McDonald?
I completely agree with Director Spring's direction on this, and I agree with Ms. Alley's comment that you, which think she meant the board or the district here, can adapt things to the board, or the district's own way of doing things. And I think that might carry over into recognizing what's been past practice here on other matters. And I would advise or ask the chair to look at the city council's method of dealing with the consent calendar, including watching a video or listening to the recording to see how it works. And I agree with Director Katzeff's comments that there should be board comments at the beginning and the end of meetings, just as there should be public comments at or near the beginning and the end. And there was another comment that, and if you had the chair had just announced at the reports section that these are reports only, we're not going to entertain questions, then we wouldn't have had the little mini sequence when I wanted to ask Ms. Leach a question about, a program that might fit into blue zones.
Okay, are we ready to vote? Any more public comment? Okay. Roll call, please.
Okay, Sarah,
Yes.
Paul Garza,
Yes?
Paul Katzef,
No.
Okay.
Susan, yes.
Okay. Now we have to go to the main motion. So that's the amendment, has been passed. We now go to the main motion, which is to approve this as amended.
Sorry, Chair. Again, with the non-affirmative vote, it needs to be noted in the record why that vote was being casted that way. So why did Katzef vote no?
Katzef voted no because not every boilerplate has to be adjusted. Sometimes boilerplate concepts are really good. Sometimes they're not. Sometimes you have to adjust them, and sometimes you don't. And I didn't like I don't want to be part of a precedent that appears as if every boilerplate that is presented to us has to be adjusted. Is that satisfactory?
That is. Thank you so much. And yes, now we have the main motion on the floor as amended.
Okay. Okay, roll call, please.
Okay, Susan, yes. Sarah,
Yes.
Paul Garza,
Yes?
Paul Katzef.
Yes.
Okay, we have a records retention policy. Congratulations. Okay, let's go on now to our regular calendar. I'd like to, Ms. Garrity is going to give us a report on the seismic compliance team. Ms. Garrity.
Good evening. Thanks for having us. I am happy to report that our weekly meetings are going along well. And the biggest news is what Kathy announced a little earlier this evening with the community meetings. We are increasing and starting to increase some communications from the district, starting with some social media posts, working to bring more awareness to the community about the state of the district. And I think that's all. Kathy Kathy, did you give an update from Dudley about the seismic? I think you did, right? I think I did. Okay, that's for later, or is that for now? Okay, there we go. And we have the update from Devaney Group that Kathy will give. Thank you.
One of our consultants, and he is telling us about the next steps in the seismic retrofit. And I'm learning a lot of language I never thought I'd know. And I want you to know a couple of definitions. SPC 4D MTCAP phase, that stands for the structural performance category and relates to elements that hold up the building columns, beams, etc. And the MTCAP stands for Material Testing and Conditions Assessment Program. This process involves taking physical samples of the building structure and testing them to make sure that the elements meet the physical properties that the basis of design used to come up with a proposed upgrade. Devaney will be submitting a proposal next week for this effort, which will mainly be structural and geotechnical involvement. This proposal will be for the MTCAP design and the new geotechnical report. Per the seismic compliance plan that was approved by this board and HCI, this phase started in Q2 of 2024. And HCI, if you don't know, stands for Healthcare Access and Information. It's a department in the state of California.
This is the group that is funding the majority of our pre-development costs for the seismic retrofit. They have already granted us a very significant amount of money, and hopefully we'll continue to draw down those dollars. Okay.
So they've submitted evaluations, a packet that was submitted to HCI at the end of last year per the interim deadline requirements, and it's currently under review by HCI. No updates yet. And then the NPC 5 evaluation was submitted to HCI at the end of last year, also per our deadline requirements, and is currently under review by HCI, and no updates yet.
I believe that's all we have to report at this time.
Okay, and the board have any questions at this point for Ms. Garrity or Ms. Wiley? Okay, seeing none, let's move on. Now we have a very significant item to discuss, and I'd like to call on our Measure C Committee Chair, Mr. Hurst. Recognize you, please, if you go to the podium.
Thank you. I really do not have anything to add to the attachments which you have before you. I'll be happy to answer questions for clarification. You have two actions to take place. One is to adopt or make official the record of receipts and allocations. And then the second item is the movement of significant funds from the Measure C committee to your unrestricted accounts.
Okay, this is clearly an important issue. Any questions from the board members at this point?
Yeah.
Go ahead, please. Ms. Director Katzif?
Where is this money housed right now? Where is
Sorry,
its home?
say again, Paul?
Where is the funds? The
Okay,
unallocated funds, which is
the-
the total $4,795,000. Where is that money?
The ordinance or the Measure C require the establishment of a separate account in which the money from the parcel tax would be deposited. Previous boards have not done a very good job of depositing that money and moving it because it comes in one check with your property tax funds and your parcel tax funds. And so the district treasurer, whoever was in charge of taking care of the checks that would come from the county, would put it all into the property tax funds. And then the Measure C committee would say, where's the money? Just like you ask. And so we've monitored that and followed that. And the first sheet that says labeled official record of Measure C funds said that as of January 1, 24, there had been $3,731,703 deposited on deposit. That was in the account. There should have been $4,795,000. So the true up that was necessary was $1,063,000. This was considerable progress that was made when your board was elected and when Jade was here as on the board, and you moved a lot of the money into the account as you should have. But as of January 1, 2024, that account, the restricted account funds, was still light $1 million. And the Measure C committee reviewed that. Sarah Spring was was at the meeting, and we all agreed, and Measure C committee approved this as the official record. So that's the starting point. So you have $3,731,703 in a restricted account.
So, and if I understand this correctly, Mr. Hurst, when you're talking, reference to the treasurer, you're talking about the county's treasurer
No.
I'm talking about the previous 2 or 3 treasurers
of the district or the county?
of the district
Okay.
who things were
Commingled the
done
money.
correctly. But the Measure C committee monitored it,
Okay.
took the money, took the information from the county and kept track of it. That's what this record is. This tells you every dollar that was received, every fee that was paid out, every exclusions that were provided. And so, and as of the 24th, as of January 24th, 2024, there was $4,795,000 that had not been allocated. Only $3,731,000 of that was on deposit. There was still $1 million floating in one of your other accounts. I suspect that it was in your property tax account, because that's where the money goes from the
Okay.
county.
Okay,
So,
okay.
You didn't answer my question, but thank you for
Yes.
the- explaining to the public the system.
Yes.
But where is it?
Can I answer that for you?
Yes, please.
California Bank of Commerce in its own bank account.
And I know that you negotiated something that included interest.
Yes.
Could you explain to the community what you did? Because this is an appropriate place to explain that.
So we moved the money to the California Bank of Commerce so that it could earn interest. So far, since transferring it mid-January, it's made roughly $18,000 in interest.
Thank you.
Okay.
I would just point out, Paul, that the Measure C committee doesn't handle any of the
I
money.
know.
We're just a tracking agency.
Okay.
Try
You're
to track
looking.
it.
Yep.
Okay, are there any more questions from the board members at this point? Okay, with that, either public comments?
Yes.
Okay, Linda, Ms. Williams?
Yes, thank you, Linda Williams. I have a question then, knowing that the 3,731,703 is in the Bank of Commerce. When is the board going to move the additional $1,063,856 over into that account to true up the Measure C funding?
restricting $2,500,000, deduct the true-up, $1 million, and just free up $1.5 million. I'm just using round numbers. Those numbers are all on your report. And problem solved. You would then have 2 million. This is on your second sheet, approved allocations. It's 2 pages. You would then have 2,210,095 as in your bank balance. So you've cured the true up. If you don't want to do it that way, then go ahead and transfer the $1 million in and then take it back out the next day. I just, I'm
Yeah.
the Measure C committee went through with the hospital staff, with Peter Johnson and with Sarah Spring, and we went through all of the allocation, all of the expenditures that had been made and reported in November 1st, 2023, and determined that $2.5 million met the criteria for Measure C. There's another 3 items that total 58, $1,000,003, and so there's $1.4 million that is still Measure C committee is looking at, which could then come back to you, and that money could be unrestricted and moved into your, I'm not sure what funds, I'm not familiar with all your funds, but I would expect that you would put that into, for general fund use.
Okay.
Sarah would probably have more
Okay. Are there other?
specific information.
I appreciate that very much. Thank you. Are there other, okay, Mr. McDonald. You need to stand up and take over the podium, please.
Thank you for the reminder. Correct me if this is supposed to go somewhere else, because maybe Director Spring is the one to answer it. And now I gotta look, on the balance sheet that we have as part of the attachments, we have a total, not counting the potential IGT payment, of $13,300,000 as the cash that the district owns. Does that figure reflect the subtracting the roughly $2 to $2.5 million that will go to?
No, it's part of the Measure C account. I can't do anything with it without board approval.
Right, I understand. I just wanted to make sure.
But basically, it's gonna move from A to B.
So once that's spent or allocated, then that 13 million would be more like 10 point something.
No, the number will stay the
away.
same. It's just moving it from one pot to another.
Okay,
I believe, Mr. McDonald, your question is that if that money is allocated, then it would reduce the overall balance of the money on hand that the district is handling, correct? Correct. Yeah. So that's what he's suggesting.
And it's not, it does not.
Okay, so you're saying that the Measure C monies do not appear on the balance sheet?
No, they do, but it's just gonna move from the Measure C account to another account. It doesn't disappear.
If it's spent,
It was spent, but we're replenishing our money.
Okay.
Because then we can pay them
right?
$1 million
Because
again
new
later.
taxes come, correct?
No,
Yeah.
it just frees up the money. So the whole point behind it is that we free up the money, then we pay them $1 million plus twice a year.
Right.
And then we pay them $1 million plus. This is to help us pay the $1 million.
It reduces the restricted Measure C account balance and increases your general fund account.
Okay, okay. Is that?
But the
I'm
total dollars
struggling with
are
the same
still
thing.
the
Okay,
same
thank you.
Until you allocate
the question.
again.
Can
Okay.
I ask one more question to Jim?
Yeah, please, Director Katzip.
And hopefully this doesn't sound too naive. So explain to everybody what restricted and unrestricted is to the, talk about unrestricted versus restricted, because I have a simple follow-up question to that.
I'm sorry, Paul, I'm having a difficult time. My hearing in your mask,
Okay, I'm sorry.
That's okay.
I just didn't want to give you COVID.
I appreciate that. I'm
Okay,
far enough away
Or
from you.
all right.
What-
I
what's
don't
your
have
question
COVID.
again?
I wouldn't be here.
What's your question?
My question is, please explain to the public what restricted and unrestricted funds are,
Good.
in your opinion.
Yes. The parcel tax has generated since 2019, $9 million. It generates $1,750,000 approximately a year net. And that was what had been projected when it was passed. That money is required by the Measure C to go into a restricted account. That money is available to the hospital district to fund the $2 million obligation that you have to Adventist Health. But to use that money, it has to meet 8 criteria established in Measure C. So when a project, either before it happens or after it's happened, is asked to be considered for Measure C, the committee then evaluates to see if it meets those, one of those criteria. The Measure C committee over time liked to try and balance the money between the 8 criteria, but that's not always feasible because the floor improvements or roof improvements at any one time can be very expensive. So that money can then be, when Measure C committee has said, yes, that money can be used for these projects, then it can be unrestricted and become your general fund purposes to use that money however you want. It's confusing because when the district was operating the hospital, the district was spending the money. And the Measure C committee would approve it and the money would go to the district. Now, the district has a responsibility to Adventist Health in the lease agreement of $2 million a year, and that $2 million has to come from somewhere. And a large portion of it's got to come from Measure C. And fortunately, there are lots of needs that the hospital has that can fit in those criteria. But you're not giving that money in addition to Adventist Health. Your obligation is $2 million. How you account for that money is where the Measure C comes through and unrestricts those funds.
Thank you.
Does that help?
Well, I think it helped a lot of people, not just me. Thank you. Appreciate it.
Do you have a follow-up question?
No, he answered it.
Okay, great. No, we have to have you come and teach us more often. Thank you. Okay, any more questions at this point, comments? Okay, then can I call for a motion to approve Measure C Committee's official net tax receipts and allocations as of January 1st, 2024?
I make a motion to approve Measure C's net tax balance as of January 2024.
Okay. Second?
Second.
Director Katzif, second? Okay. Any comments? Discussion, further discussion? Okay, roll call?
Okay, Paul Katzif,
Aye, yes.
Susan, yes. Sarah?
Yes.
Paul Garza?
Yes.
Approved.
Okay, now can we move on now to item 5C, to review and consider Measure C's recommendation for the allocation of Measure C funds. That is $100,000 for the Cypress roof, street roof, $230,036 for foundation purchase of an ambulance to be owned by the district, and then $2 million plus, I'll just say, additional items for the, listed on the Adventist Health Report on Building Maintenance and Expenditures Report. Again, asking for Mr. Hurst to comment upon this and direct us.
So we just approved them.
No, we approved 5B.
Right, but by doing 5D, we approved the new expenses because they were included
attached,
on the
right.
list.
Where is that list?
Right here.
What page?
In 2024,
What page is on that?
I know, I see that.
after January 1st, in our meetings in February 12th and February 25th, we approved $100,000 of money for the Cypress Street roof and $230,000 for the ambulance that the foundation wants to purchase. In addition to that $330,000, the Measure C committee reviewed the expenditures that Adventist Health reported to you and said $2,200,000 of that meet Measure C criteria. And those are listed: auto transfer switch, medical air replacement, central sterile system, etc. And so we are saying to you that the $2,585,000 that have been spent.
Okay.
Except for the $300,000 that's been spent already. It's okay to unrestrict that money and move it to your general fund. We're saying, however, you have a true-up of $1 million, so don't transfer that. So transfer $1,521,000, and everybody's finally, after 2.5 or 3 years of trying to get this straight, you have the right amount of money.
Okay.
And all the numbers finally are in agreement. What was happening is that we would go through this process, and the representative would agree and come back to the district board, and nothing would ever happen. So we'd have an agreement that $1 million or $700,000 would be transferred. Never happens.
Okay.
So I have a.
For whatever reason, it's not important.
One follow-up question.
We're moving forward now.
So, this is the first time I've seen this list. All right? So, let's say this list was presented to the board, am I right? Or was it presented to the Measure C committee only? Or is this an accumulation of multiple requests?
These are not requests.
These are demands.
This is money that's already been spent. You have provided $2 million each year. And Adventist Health is reporting to you that we have spent, I don't see, I have it here. Adventist Health reported to you that as of November 23, they had spent of the Measure C last allocation in 21, the 2.25 million, that they had spent $2 million. In addition to that, they had spent $4 million on various projects. So the Measure C committee looked at each of those projects and said of that $4 million, we're ready to say $2.3 million fits Measure C. So that's money that you can move from restricted accounts to unrestricted. How you choose as a district then to spend that money is up to you. You have met the requirements that this money that has been spent by Adventist Health meets the criteria of Measure C, the 8 criteria.
Go ahead.
Okay. So if I understand from comments from Mr. Hurst and from Directors Spring and Savage, 5C is moot.
Correct.
Okay, so let's go on.
Can I just make one point so that everybody's aware?
Yeah.
So the $230,000 plus for the ambulance has not been spent. So that money will need to be earmarked to purchase the ambulance.
Okay. Mr. Ramos hasn't spoken yet, so let me give you an opportunity.
Thank you. Terry Ramos, I just want to talk about the ambulance. It says for foundation, we are not planning to transfer that money to the foundation. Foundation is planning to help you purchase that ambulance. We've done the quote and those things, but the money's not being allocated to us. Okay.
Okay,
It's
thank
a
you.
partnership with a three-way.
Right, okay. Mr. McDonald, please come to the podium.
Thank you. I think what Director Katzef is getting at, he'll correct me if I'm off, and what I think why Chair Garza was moving to 5C originally is that Measure C committee, they hear requests from Adventist Health, they recommend which things to, you guys know the process of that, but this board has to approve those expenditures. To the best of my knowledge, the expenditures have not been approved yet. So as Chair Garza was starting to say, you have to go through the 5C procedure in order to approve the expenditures.
Director Katzef, you, go ahead.
Because the district provides by the
Sorry,
agreement.
we need the person to speak into the mic, please. Committee Chair, do you mind speaking into the mic? We can't hear you online.
I'm sorry.
And that means it's not going to get into the record.
Yeah, I'm sorry.
Ask pesky clerk and her record.
Go
was
ahead,
that?
please.
The district is obligated to provide $2 million under the lease agreement. Those funds are not restricted to, or Adventist Health is not restricted to how they spend that money. They give you a report as to what it's spent. You ask, they ask, and you ask that the Measure C committee see if any of those expenditures fall into the criteria so that you could free up money to have in your general fund. Again, I sort of got off the track, I suspect, but prior to the lease, the projects would come to the Measure C committee as something to be done in the future. Now it comes after the fact most of the time. Doesn't have to. You have $2 million sitting in that Measure C account, which you can come up with your own initiatives, your own things to do. But you have a limited source to draw that $2 million from. And Measure C is a big portion of that. Your $875,000 or so that you get from your property tax is another source of that. The lease payments that you receive from Adventist Health is another source of that. You know, so you've got various little pods that you can pull your annual commitment.
Jim,
Yes.
we don't do that. In a year and a half that I've been on this board, that is a foreign concept. So my question then is, Who checks to see whether this stuff is done?
That's a very good question.
Mm-hmm.
And I think a lot of it has to be taken on faith.
Of course.
If Adventist Health gives us a report, gives you a report that says for the medical air replacement, this cost a total of $1,242,000, then I think you have to accept that. I mean, if you want to deputize somebody to go and look at all the work that was done, or, but I don't think that's where you want to go. Measure C responsibility is to report at the end of the year, fiscal year, in the beginning of each fiscal year, the money that's been spent in the previous year met the criteria. So, I don't, it's a tough question. I don't have the answer.
Judy has the answer.
Judy?
I appreciate the questions, and yes, we would be pleased to share with the board, with Measure C, anybody, the work that's been done, along with the receipts for that work. Obviously, some of it is not something you can see visually, such as the item that was brought forward, right? But we can certainly show you that the work has been done and the receipts that correspond with it, which is what Measure C received, and we'd be happy to share that with this board as well.
Okay, thank you. Director Spring.
To cover all bases, can I make a motion to approve? We'd already approved the roof and the ambulance, so the balance of the repairs and improvements. So let's just go forward to the next one and approve that they all meet Measure C requirements and take Measure C's recommendation to cover the cost of those repairs.
Okay, so that what you're requesting is that we approve the action as indicated in the agenda,
Correct.
5C, which is to approve Measure C committee recommendations for expenditures of Measure C totaling funds 2,585 and change. Approve transfer of 1.5 whatever to Measure C restricted account to the district unrestricted account, leaving a balance of 2,100,095 in the restricted Measure C account. Is that correct? Okay. Do I have a motion? Do we have a second?
I'll second.
Okay. Any further discussion? Okay, roll call, please.
Okay, Sarah,
Yes.
Paul Garza,
Yes?
Paul Katza,
Yes.
Susan, yes, approved.
Okay. Thank you. Thank you very much. I really appreciate your patience with us. You've been at this for a very, very long time, and probably you clearly know it better than any of us in the room. We very much appreciate it. Okay. Let's go on now to item 5D. And before we begin that, I want to thank Treasurer Spring for her efforts. She's done a lot of work, and I was really pleased to see that we have a very, very robust documentation and much more complete information. So thank you. But this is your item, so please go ahead.
So there's the balance sheet, which has the balance of all the accounts. So Paul, just so you can be clear of where the money sits, about midway down the page, you will see $3,800,000 in a Measure C
37.
account.
I'm looking for the page.
That's okay, you can just use this, I'll use yours.
Now, I want to be clear, that number will now start including interest. So it will start increasing even when we're not getting money from the Measure C taxpayers. The other item I wanted to report regarding the balance sheet is that the IGT money should be coming to us hopefully by the next meeting. It's in the works, and the other people are getting ready to input the money so that we can have our money back.
Okay, that's also very, very good news. Very good news.
Does anybody have questions about the balance sheet?
Any board, questions from the board? Okay, comments from the public, questions? Okay, we have none, so we have a motion to approve the warrant list?
Okay, I have a question, and this is just because my experience with how these things go, that generally I had thought that we accept the report of the treasurer, and then separate from that, might approve a warrant list, approve other expenditures, but there's a motion to accept the report. Is that not part of what you want to do with this report? Because it acknowledges.
I'm happy to do that if you know, yeah, I'm happy to do that. So we have a motion first to approve the report?
Well, to accept.
To accept the report,
I would move that we
yes.
accept the report of the treasurer.
Okay, thank you. Thank you, that's a good clarification.
And
Okay, do we have a second for that? Well, I'll second it.
Good.
Okay, can we have a roll call?
Okay, Susan, yes. Sarah?
Yes?
Paul Garza?
Yes.
Paul Katzif?
Yes.
Okay, so the report is accepted.
Okay, so can we move on now to the balance sheet, or is it the
The
balance
warrant
sheet?
list.
The
The
warrant
warrant
list.
list, okay.
Right. And
Have a motion to approve the warrant list?
I would move that we approve the warrant list.
Okay, is there a second?
I'll second for discussion.
Okay, moved and seconded. Director Spring?
So I want clarity from the full board that RGS is a one-time expense from the district funds and not the board funds.
Well, I think you have to explain what you mean. I know.
The board has, the board gets,
Director,
may I?
yeah, please, but please speak through me, please.
Okay,
Just trying
Chair,
to keep order here.
the board has a budget of $250,000. Am I on course here?
You are on
Great.
course.
It's not to come out of that. It's to come from somewhere else. Now you can take it to the next step.
So I want to be clear that this money is not reducing from our 250,000, that it's coming from the district budget, which is all other money than the $250,000 allotment.
Okay, Director Savage?
Well, and just to kind of revisit past history, when you and I brought the original proposal, we may have been less than articulate about where specifically that money would come from, but our clear intention, and I remember speaking to it at the time, was that this was not to be taken out of the ongoing $250,000 budget, but this was hopefully a one-time expenditure to put our house in order.
Okay,
And that was the way we presented it, and I believe what was approved.
yep. I believe you're correct. So is that helpful, Director Spring?
I would like to have it more clear on the record, because I did not infer that from the way that the motion was made.
And I don't think I was here.
No, you were here. Yeah,
You were here.
you were here. Yeah, you were
Where am I
here.
now?
Okay, so, point of order, I guess. So currently we have a motion on the floor, but perhaps do we need to have either a substitute motion or
Could we
No,
let,
remove or withdraw the previous motion to have a motion to clarify exactly what she's asking? How procedurally do you want to move?
Well, I think she's raising a separate issue. I think one is to approve the warrant list. Okay, those are the payments, and then there's the second issue is that to designate.
And where do they come?
Designate that payment does not come from the district's budget. right?
Correct.
Okay, so
Make the motion.
effectively, so we need to amend the current motion first. Okay? So the current
Well, the
motion,
current
as I,
motion
can we
was-
read back the motion, Ms. Wiley?
You've got it.
Go.
Well, the motion that I thought we had on the floor that I moved and Sarah seconded was to approve the warrant list.
Okay. Okay, so that, and now we have an amendment to that.
Do we? Or do we approve the warrant list and then have a subsequent motion to give Sarah direction about where those RGS funds are going to come from?
Yes.
Yes.
Secretary Savage is correct.
Okay. Okay, good.
Yeah.
Okay,
yeah.
so look, can we approve the warrant list then?
We might. And I don't know
I
where
need
we
a roll
are
call.
on people's comments or any of that. Are we ready to call?
Are there public comments on the warrant list? Mr. McDonald?
I think you're on the right track now, thanks to Ms. Alley, but I want to back up what Director Springs said, that the motion that was made on December 14th was simply to use one-time funds.
Yes.
There was little, if none, no clarification about whether it was from the district budget or the board budget. I don't recall that being brought up at all.
Yeah. I'm sure you're correct. That's my recollection as well. Okay, so can we, the warrant list is now subject to, can we have a roll call on the warrant list?
You have one more hand raised, sir, here on Zoom.
I'm sorry, Ms. Williams?
Hi, thank you very much. I have a question in regards to the balance sheet. Is that equivalent to the P&L? Okay, will the P&L be discussed at any point?
Tonight?
Yes.
No.
Because there's that negative $4,929,000 that I thought you were going to have a response for, but okay, that was my question.
Okay.
We have no other hands raised on Zoom.
Okay, thank you.
Okay. Okay. Paul Garza.
Yes?
Paul Katza.
Yes.
Susan Savage, yes. Sarah Spring.
Yes.
Okay, so the warrant list is approved.
Okay, so now can we have, now we have a motion to consider made by Director Spring to designate that the payments to RGS come from the district budget and not the board budget.
And I'll second that.
Okay, is in a second from Savage. Any comments? Questions? Mr. McDonald?
I don't see anything on the agenda that refers to RGS and the budget, so I don't see how we're creating action items here again. I think what you could do is make sure that Director Springs' comments are noted specifically in the minutes of the meeting, and then hopefully recordings get back online, and so people will be able to see that.
Ms. Alley, you're our process expert. Is that the best way to move forward?
So this agenda item is advertised considering approval of the warrant list and providing the treasurer's report. It is the treasurer who is asking for clarification and direction under her report for this action. I do believe it is sufficient. As it's stated, that the treasurer is trying to get clarification as to the warrant list, and if that expenditure was correct, I do think it falls under a justified motion, and you can move forward as is. It does not need to come to a future agenda.
Okay, thank you. Then I think we'll go forward.
But it was an excellent question. I do appreciate that the question came up.
The treasurer's report was already dealt with earlier in the meeting.
Hey, Marshall, could you turn the volume down just a little bit? Just sort of-
I cannot understand a word she says.
Yeah, that's okay.
So I believe that she said we may proceed.
Yes.
Is
Yes.
that correct? Okay. All right. So Susan, yes. Sarah? This is for your motion.
I know. I'm voting no. And I'm voting no because I don't agree with spending the money on RGS.
Okay, and Paul Garza
Yes?
and Paul Katzit.
Yes.
Okay, it's approved.
Okay, thank you. Now let's move on to the standing committee meeting calendar, which is item 5E.
So, point of clarification or order or something, I believe, am I right, that you need to have a motion on the floor to adopt first before we discuss amendments to it? Or do you want to have a discussion of something that needs changing first? How would you like to proceed?
Chair,
I'm
maybe I
sorry,
could
I'm not-
clarify.
yeah, I'm not okay.
I might be able to clarify. Susan and I talked about this earlier. The Finance Committee gave their finance minutes, and in those minutes were the dates of the third Thursdays.
It's not the third Thursdays. It's because we discussed that, because of the timing of when the Finance Committee might most effectively meet wasn't always on a predictable first, third, second Thursday, any of that. So we gave you specific dates.
Right.
That doesn't fit that pattern.
Right, and so to remedy that, my suggestion would be that we just go ahead and actually list the dates out on this sheet.
Yes, exactly. Exactly, and that was going to be my amendment.
Fine.
But I don't know if you need a motion on the floor to adopt this, and then I move to amend it, or how you would like to proceed.
Well, I think you just make the motion with that specification, and then we don't need an amendment, right?
Perfect.
Right.
Okay. Okay, I would like to move then that we adopt the committee meeting calendar with.
Before we make a motion,
Pardon me?
before making motions, we should get public comment, so the public has an opportunity
Okay,
to
right.
provide you their,
That's right.
their comments. Is maybe that might change the motion.
That
But we
might
need
have.
that staff report, public comment, and then time for motion,
Okay.
please.
So any public comment at this point on our schedule? Mr. McDonald?
I'm going to reiterate what I said last meeting, that although I'm going to add to it, although the bylaws that you're working off of that were supposedly passed in November of 2020, that meeting, there are no minutes that record that happening. There's no video or audio recording of that meeting. That's a tangent to that. What I'm reiterating is the advice of the chair at that time to, instead of have standing committees, to have ad hoc committees, which still invite public members to participate and the public to participate if they wish, but not to be run under Brown Act rules. I think that's an important thing. And as I said, I believe if you go back to the August meeting or the minutes of it, of 2020, the regular meeting, you'll find the bylaws and the annotations, and next to that, you'll find the initials of the chair at that time with that recommendation.
Okay, that's an interesting bit of information, Mr. McDonald, but it's my understanding that our conditions of the bond with Mellon requires us to have a standing finance committee. We've got that advice from Shin Green, so it appears that we have that obligation. And now that raises the question of the planning committee of how we can do that, but the finance committee, I understand that we're required to have.
Okay, may I?
You make your motion? Now,
Okay,
please
I
make
was
your
looking to
motion.
make sure. Okay, so I would like to move adoption of the calendar of committee meetings with the exception of meetings of the Finance Committee, which would be held according to the report included in the minutes, which lists specific dates of when those meetings would happen through October.
And those are April 18th, May 23rd, June 20th, July 18th, August 22nd, September 18th, and October 24.
Yeah, all at 1 o'clock at our office. Is that correct?
Correct.
Yes.
Okay. Okay, do we have a
Die for
second?
lack of
We
a
need a second first.
Oh, I'll
Nicole.
second.
Okay, all right. Director Spring?
Point of clarification, Kathy, can you send me the deadline for the, agenda,
Yes.
relevant to those dates, please?
Yes.
And again, I very much appreciate your efforts to get us documents in advance now. We've really stepped up, and of course, there's more that we need to do, but we're going the right way.
Thank you.
Okay. Okay, so can we do, we have a second, can we roll call now?
Okay. Okay, Paul Katza,
Yes.
Susan Savage, yes. Sarah Spring.
Yes.
And Paul Garza.
Yes. Okay, let's move on now to our final major item of this evening. That is to review and consider approval of procurement of the Chief Financial Officer Services. This is a report that unfortunately, Director Savage's name was not included in this, but it's really a report coming from both of us as the policy committee. Okay. So let me go through this carefully. I remember receiving comments at our last meeting. They're very pointed about our financial responsibilities and how they are very important, and we needed to really pay attention to this. So we have done a lot of work on this particular issue, including consulting with our attorney and getting his best advice with Shin Green, who has a role in, of course, the bond. And we've looked at requirements upon us by the State Controller's Office. We've had conversations with Mellon, the bank. So there's a lot of work. So let me go through this really carefully. This is quite important. So I'm just going to go through the report. A brief examination, beginning with the background. A brief examination of the public financial documents of the district reveals significant concerns. The district's most recent audited financials are for the period ending June 30, 2020. Now, we know that we're making good progress on our 2021 audited statement, but nonetheless, that's the situation we find ourselves. Between March 23rd and 2023 and March 21st, 2024, the Standing Finance Committee did not meet, despite the requirements in the district's bylaws for regular meetings, at least quarterly reporting. Budget documents and financial reports are inconsistent in content and format, and the timing of delivery is sporadic. This creates transparency issues for both the board and the public. It is unclear whether the expenditures of the district are properly authorized, as the board rescinded fiscal control policy number 3 on September 21st, 2023, and has not further issued policy clarifying any delegation of authority with regard to payment of expenses. The district's investment policy, adopted on September 21, 2023, likewise is unclear as to the authorization to make investments. In short, the financial management practices of the district for several years have fallen short of compliance and established bylaws and regulatory requirements. These deficiencies have consequences. Recently, the district received correspondence from the state controllers, as well as several financial organizations with oversight or trustee roles relevant to the district's revenue bonds, requesting financial documentation and outlining penalties for failure to comply. This correspondence was presented last month, and a new letter from Wildan received since is attached. I requested an opinion from legal counsel as to the potential consequences of noncompliance, which range from fines to possible prosecution, and recommendations for remediation. See attached memo. And let me then skip to that memo, and without going through a whole lot of detail, basically the summary is the district is required to prepare annual audited financial statements and other reports pursuant to state law, and is required to timely provide such financial statements to various agencies, including the State Controller, CHFA, BNY, Mellon, and MSRB. Obviously, we are not aware of any reporting arguments. Okay. Failure to file such financial statements and reports could result in monetary fines, action to compel specific performance, acceleration of payments on bonds, reports to the county grand jury, prosecution by the Attorney General, and the inability to issue additional bonds or other obligations. It is therefore our strong recommendation that your board take additional steps to ensure that the district prepares and files all past due audited financial statements and other required reports as soon as possible. Given the failure to make such important filings on time under the current financial management structure, the board would be well advised to consider bringing on a new staff or consultant to get this work done as soon as possible. So let me move on from there. Going back to the staff report. Additionally, the district is urgently required to make key decisions about acquiring significant funding for mandated capital improvements. Comprehensive financial policies, accounting, and reports are essential to both decision-making by the board and access to cost-effective options for funding. Now, I'm moving on to analysis. Since affiliation, and frankly, we all know that this is the elephant in the room, this has been the thing that has frustrated our attempts at getting audits done, and Director Savage, Director Spring could lecture you for a long time about how the complex process has been to try and bring this, sort things out so that we could proceed with it. But anyway, since affiliation, the district has been unstaffed, and efforts by members of the board to fill the financial management role have not been successful. Unsurprisingly, as the district had a CFO and accounting staff performing this work prior to affiliation. The work needed for accurate, compliant, and transparent financial record keeping and reporting truly exceeds the capacity of a part-time unpaid board. Okay. Recently, the district contracted with CSDA for financial activity report, but the service is limited in scope and duration. CSDA is not staffed to provide the level of support required. And I would mention that in the past month, we have received a email from CSDA indicating that they are not prepared to provide a chief financial officer function for us. So to further go on, the district has a critical and immediate need for restructuring its financial management report. To address the identified deficiencies, bring financial reports up to date, and ensure future compliance with regulatory requirements, it is imperative to contract for the services of a professional and qualified chief financial officer. The appointment of CFO will provide the necessary expertise to navigate complex financial matters, establish robust financial policies and controls, and oversee the production of accurate and timely financial reports. Furthermore, the CFO will play a crucial role in ensuring adherence to both the organization's bylaws and regulatory standards, thereby mitigating the risk of incurring penalties and reputational damage. By contracting for CFO services, the district can immediately address our current financial challenges and lay a solid foundation for sustainable financial management practices. There are no restrictions or requirements in district policy that recruit or limit the board from selecting a contractor to perform these duties, nor is there a limitation in the health and safety code. Failure to take immediate action not only jeopardizes future access to funding as well as compliance with regulatory requirements, but also undermines public trust and confidence regarding the use of taxpayer funds. And then I refer you to the memorandum that we received from Shin Green. I have in my package here. And let me just highlight a few of his comments because I think this is, well, where did I put it? Well, I know I have it here in this package. Okay, first, Mr. Green indicates that he says that we would note the lack of a dedicated district finance-focused staff member has placed the district out of compliance on certain debt-related covenants, as well as made it difficult to meet other financial reporting and compliant requirements specific to the debt of the district. And he goes on to say the current state of financial management and reporting of the district could negatively impact the effectiveness of any potential bond. It goes on further to say in his memo that having a history of not providing timely continuing disclosure information can make it exceedingly difficult to obtain independent credit ratings for prospective new debt issuances. And that such entities, those referring to those that do underwriting, will generally not assist in the issuance of debt for issuers who are not in compliance with the continuing disclosure requirements for an extended period of time. And for those of you who are following along in your packages, I'm looking at the highlighted sections that Mr. Green has indicated. Understanding the district will also be engaged in potential tens of millions of dollars in construction projects that will also be critical to ensure that there is a dedicated individual or firm tasked with project accounting. With a potential new general obligation bond, it will be critical to make the most efficient use of taxpayer investments as possible. And then he goes on to finally say that if the district were to proceed without the ability to produce regular financial reports and audits, it is safe to say that we would project interest rates to be higher by at least 0.1% and probably more on the order of 0.25. Such an increase could easily result in over 1.5 million in additional interest expenses or more. So and then he goes on to say, East Shore highly recommends that a dedicated individual or firm be retained to return the district to compliance with reporting requirements. The dollar amounts are too large, the risk too great, and the potential efficiency gain too impactful to not merit the consideration of retaining a dedicated individual. I think, okay, so we have a number of options before us. We have a draft of scope of services for a CFO is attached for the board's consideration. Essential qualifications for a service provider include California government finance experience, which includes knowledge of fund accounting and categorical restricted funding requirements. In the short term, and due to immediate demands for financial records, a provider would also have experience in the healthcare industry as industry-specific regulations apply. A lack of understanding of these principles has resulted in much of a lack of clarity that the board has struggled to overcome in order to make effective decisions. The RGS team has identified either a sole source or an RFQ process as appropriate alternatives to transparently and promptly obtain a qualified contractor. Sole process source procurements generally include considerations such as unique specifications and circumstances requirements, services or goods available only from a single source supported by the due diligence that was performed in determining that this is the only solution to the user's needs, and then services are needed to address an emergent or related time-sensitive need. A potential service provider is available. Mr. Wayne Allen, former CEO of the Mendocino District Hospital, and now a consultant providing healthcare financial services, has indicated a willingness to provide short-term CFO services to assist the board with required corrections, as well as the establishment of policy and processes to properly maintain financial controls, records, and compliance. Mr. Allen is highly qualified, and his specific familiarity with the district would result in immediate and positive outcomes. A learning curve might otherwise be anticipated should another qualified service provider be available. If this option is preferred, the board may authorize the chair to negotiate a contract for service subject to review and concurrence of legal counsel. And by the way, Mr. Allen's proposal has been reviewed by your attorney already. And he has agreed to some modifications that our attorney, Mr. Steele, has strongly recommended. Going further, should an RFQ process be considered, the RGS team has identified 5 potential providers who could be solicited directly and promptly for a statement of qualifications. These organizations were sourced through their affiliation with the California Society for Municipal Finance Officers and appear to offer potentially relevant consulting and financial services with appropriate California public sector expertise. Note that RGS has no experience with any of the providers and is relying on website presentations of qualifications. If this option is preferred, the board may appoint an ad hoc committee to issue an RFQ, reviews responses, and recommend a provider with whom the chair may negotiate contract service subject to review and concurrence of legal counsel. In either case, the contract for services will be promptly presented to the full board for approval. The board's authorization of one of these expeditious processes to retain a qualified consultant as CFO will demonstrate our commitment to sound government practices, mitigate financial risk, and position our organization for long-term success and sustainability. And with that, there's just a note that there's potentially significant impact, although we do have a proposal that is remarkably and relatively expensive considering all of these things. So with that, are there any questions from the board members?
Why would the treasurer not be part of the committee to do this?
There's nothing here that says who would be the committee. It's just that it would be an ad hoc. That's all.
It's just a Public, I would like you all to know that anything to do with money that this chair does, I'm not included.
Okay, any question? Go ahead. Director Savage?
Well, no, I just had noticed that
Right.
Mr. Allen is on the screen, so I didn't know if there was an opportunity before we start discussing to.
When we get to deliberation, we can include that if you'd like.
No, I would like now, personally.
Right now?
Yeah.
Okay, I guess that's appropriate. Okay, Mr. Allen? Mr. Allen?
I want to make a comment.
You're muted.
before-
Is he there?
Yeah, he's there, but he's
Wayne,
muted.
you're muted.
Which one is he?
Bottom left-hand corner, Wayne.
There you go.
There you go.
Are we okay now?
I can hear you now.
All right. What was asked? Had I comment?
Yes, yes, I would like to hear from you and your proposal and how that fits in your view to the needs of the district.
My general comment at this point is it's a pleasure to offer my services. I have a great deal of experience and a lot of it at the district hospital in Fort Bragg. Their financial system is broken at the moment. I think within the next 9 months, it can get on solid footing and you'll start to get very accurate and timely information, which you desperately need. A lot of discussion on Measure C this evening with Mr. Hurst was quite interesting, and that needs to be reviewed and evaluated, and I'm capable of doing that. I've got a background in that area, and I've got a background with Adventist Health. It was great to see Judy Leach there tonight. 4 years ago, gave her the key to the hospital, and I look forward to visiting with her about the future. So there's so much that can be done in a short period of time. You have really a simple operation. The financial system needs to be kept very simple, and we can do that and produce good reports and get the district information it needs.
For your proposal, your employment proposal. I think that that it's really clear that you have an understanding of the issues and the experience, and that you're here and willing to start almost immediately. I want to thank you for the way you approach being paid for your services. My thought was either he needs the job real bad or he's a saint. And I think, when I get a resume or a job proposal like this, when I get one that's so specific, I worry that I'm buying into something that I may not be happy with in the long run. So what I want to ask you is, you break this up into 3 90-day sections. And if you, I want to ask you if you would break your contract up into 2 sections. The first 90 days, so we can see if you can, if you will produce on what you specifically say. And if you do, then we can go forward with the next 2 90-day periods. It's not that I am impugning your integrity. It's just, it's the way I function in my own world. So maybe I'm bringing another world into this system, but I have to ask that.
Kathy, can you sum up that question? I can't hear it.
Sure. He's asking if you would consider breaking your contract up into 90-day increments so that the board can assess your work product and performance at the first 90 days and then agree to go on with your services or not. And one answer to that might be that I believe in the proposal that you were talking about, there's a 30-day severance clause that you might want to speak to.
Yes, I'm very agreeable to breaking it up into 90-day increments with objectives and goals for each of the 3 periods. And the 30 days without cause of separation notice can be negotiated down to a lesser number of days, or if you want higher number of days, it's negotiable on the 30 days. And absolutely, I will set some goals and things that we need to achieve for the first 90 days. And
our better angels are looking out for us. Timeliness is something that when it occurs, it's a beautiful thing. So I want to thank you for being so timely, so committed to this hospital and to this hospital district. And to let you know that our better angels are working for us. I am personally in support of your proposal. I want you to know that in advance.
But technically, you're not supposed to say that, but it's a kind thing to do. Okay.
I want to make them feel good, because he
Okay.
made us feel good.
Any more comments from the board questions from the board at this point? Okay.
There's a hand up, I believe.
I know, we're just ready to go to public comment now, so
Okay,
any
sorry.
more questions from the board? No. Okay. So should I go to internet or presence first? Okay. Ms. Williams?
Hi, thank you very much. I agree with Director Katzoff. Wayne Allen has come in, and I think he's the saving grace that we've been hoping for. And at this point in time, I'd like to urge the board to hire him. And with the 30-day clause, termination clause, I think you guys are safe to do that. It appears that his expertise is something that you desperately need, and especially to keep all of the board members out of the possibility of being sued or losing the possibility of getting our bond issue or getting our bonds recalled. So I'm absolutely for hiring Mr. Allen. Thanks.
Okay, thank you. Mr. Ramos?
Terry Ramos, so I've said this many times, I'll say it again. I am all for the district having staff that can do the job day to day. You're a bunch of volunteers. We really appreciate that, definitely so. But get the staff that can do the job day to day. Thank you.
Okay, thank you. Any more comments from the public at this point? Okay, let's go.
I have
Oh,
one.
yes, well, Mr. Duvall is online. Mr. Duvall, you submitted an email message to us. We can read that, or if you'd like to speak, be happy to entertain that at this point.
He's muted,
I don't know that
He's muted, yeah.
or is he
he
there?
might not be there.
All right, well, let's go ahead and read his.
So this was received from Norman Duvall Tuesday by email to me. and he wished it to be read into the public record. He says, throughout my experience on the MCHD Board of Directors, the account balances have mostly been unknown or reported to the board in other than acceptable fashion. And an ad in The Economist says, it's best, quote, if you don't know the numbers, you are not in business, unquote. I'm strongly in favor of a CFO being retained with an experienced bookkeeper. Signed, Norman Duvall, MCHD board member 2019 through 2022.
Okay, Mr. McDonald?
I'd just like to correct that Mr. Duvall was a board member from approximately November of 2020 to the same date in 2022, so.
Okay.
Yeah, he wasn't here for affiliation.
Okay, okay, do we, now, I want to recognize Director Savage, who will present a motion.
Yes, well, and I'd like to proceed my motion, may I, with why I'm making it? Or would you rather I have the motion and then talk?
Make the motion and let's
Okay.
discuss.
I would
okay?
like to move that we proceed with hiring,
Wayne Allen.
thank you. Well, I was going to say Mr. Allen, to be the chief financial officer according to this limited contract that he has proposed. In addition, to be able to move quickly, I'd like us to authorize the chair to proceed with the contract immediately, so we don't have to take a lot more time to do that, but I'd really like to speak to why.
Okay, let's get a second.
I second it.
Mr. Katzov, Director Katzov seconds. Okay, go
Okay.
ahead and speak.
Because I think that there have been something said that it feels to me that there are way too many things that are said about what people aren't doing. The previous treasurer from the previous board, the treasurer who resigned recently, and now our current treasurer, that to me, every single one of those people have faced a huge, huge task with a multi-million-dollar budget, with multiple layers of state and various regulations to be dealt with, that it is a very, very complex thing, that to have the resources, which I think we've had multiple people from the community say that our most critical need is to deal with getting our financial house in order. And I think it was valiant to bring in Mr. Wood from the California Special District Association to help us to do that. But I personally am feeling that not to replace our treasurer, but to have the chief financial officer in place to keep us on track so that we can get our house in order fully with this short-term project, I think is really prudent money well spent. And I would move that we do that post.
Okay. Yeah, thank you for your comment. I just want to underscore the same thing. I said, this is a very complex, and I'm just beginning to learn the finances of this district, but they are much more complex. And I had a lot of experience in other organizations handling very large amounts of grant funding and other resources, $25, $30, $35 million annually. But this has so many layers of regulation and complications and relationship that it may make it very difficult. It's a daunting task. I don't want to point fingers to any of the previous treasurers who attempted to take this on. I think the previous boards were perhaps not operating in the best of the public interest by not retaining staff, but, you know, I wasn't sitting there at the time, and I certainly don't want this to reflect on either the work that was done by Mr. Tiplett before he resigned, or our current treasurer, who is working extremely hard all the time to keep up with these kinds of things. It's daunting, it's complicated, there are a whole lot of things. I don't know that any member of the board was aware of all of these requirements and dates and times that reports had to be filed, and they suddenly all came to us at one time. I'm grateful that happened, because now we're aware, but now that we're aware, we have to act. We now have been brought into, when you when you're in this kind of a position and as a public official and you become aware of something, it's incumbent then you act. You can't shove it under the, or forget about it, or go home and cry about it. Well, you can still go home and cry about it, but you know, but you need to act. So anyway, I think Director Spring and I have had our differences in the past. I assume that we will continue to have our differences in the future, but this is not reflective upon the work that she's done for the district. And I just want to make that clear. Okay? Any other board comments at this point?
Sorry.
Well, okay, Mr. Ramos.
I just want to make one comment. Given what happened with RGS, I think you should decide at this time also which budget the funds come out of, so there's no question in the future. Thank you.
Good.
Yeah, I just want to comment, Chair,
Yeah, Mr. Katsup.
that what we have to learn is what we can't accomplish individually. You have to, each board member has to know what their capabilities are relative to the task at hand. And it was really clear back 14 months ago that if we didn't have a CFO, we were going to be in giant danger. But people decided that they could do the work. And it just became more and more complicated. I am delighted and relieved, totally relieved, because my responsibilities to my family and to my community are now going to be a little bit more taken care of. You know, it's a shame that we went through all of this. This is a tragedy that has been averted by a wonderful man who I have not met, but I hope I get a chance to meet with you. And whew, I feel not vindicated, but joyous.
Yeah. Mr. Director Katzoff has, last time I spoke with him, said, I was telling everybody 14 months ago you needed a CFO.
Well,
so, and I told him, well, Director Katzoff, we have finally heard you. So, I also want to, I think that's a good point, because I also had a heart-to-heart with former Chair Finney.
I've been talking about Wayne
And,
the whole time.
And at that point, you know, she indicated she had a sense that we were probably going to be in trouble, but there were so many other things that, and they were hoping that we'd find it through, but she was, you know, in the back of her mind, and that was one of the regrets, that she didn't quite manage to get this push here. So, and just share that kind of information. So any more deliberation by the board? Okay, seeing none, let's go to roll call.
Okay, I'll vote for my own motion. Susan Savage, yes. Sarah Spring,
Point of clarity,
yes.
we didn't do what was suggested to us by the public.
Okay, point of clarity,
budget.
what I assumed is those were going to be two separate motions. Mine was, and then to have a motion, but if you want to build them all into the same one, we probably could.
No, let's go ahead, let's take them one at a time. We did
Okay.
that before, didn't we?
Yes,
Okay, let's do it again.
okay. Okay, so the motion on the floor is to proceed with contracting with Mr. Allen post haste via the chair and legal counsel to put together the contract. Okay, so I voted yes.
Okay.
Sarah,
Yes.
bless your heart. Paul Garza
Yes?
and Paul Katzit,
Yes.
approved.
Okay, thank you. So now a second motion, do you want to make
Okay,
that motion?
So I
Director
would
Savage?
make a subsequent motion that this short-term contract, which is specified, I believe, at $3,000 a month for no more than 9 months, be paid for out of district funds, not the board budget, as not an ongoing expenditure.
Is there a second?
I'll second that.
Okay. Okay, any questions for board members about the motion? Okay, public comments?
I think I do have a question, because I would be interested in our treasurer, if how that fits with your perceptions of how the funds are flowing between those two budgets. Does that work, in your opinion?
It's the only way to do it.
Okay,
We'll go over the 250,000 if we
okay,
go
okay. I
the
wanted to
other
check.
route.
I appreciate that.
Okay, are we ready for a roll call?
Okay. All right. Paul Katzif,
Yes.
Susan Savage, yes. Sarah Spring,
Yes.
Paul Garza.
Yes.
Okay, that's approved.
Okay, thank you very much. We now on to our final agenda item, that's comments from the board. And Mr. Katzif, I believe that you wanted to speak to
Thank you.
some concerns?
Yeah, I wanted to speak to the concept of efficiency. Short, fast meetings attempted, never accomplished. I think the meetings are too short, or at least they should be allowed to be longer if they need to be longer. That will give everybody a chance to come to the podium, and instead of being in the moment, so in the moment, that they forget what they're going to say, or they didn't say everything they had to say because they had to think fast, or they didn't prepare, or it was in the moment, they'll be able to slow down, relax, and know they're going to be heard at their best. So efficiency is not efficient in terms of idea development. Sometimes it takes a little bit longer to get your point across, like I'm trying to do right now. And I'm speaking off the top of my head, right? So it's sort of like, we all know what that's like. We should have the patience as listeners to allow the speaker to develop their thought and get into the zone. So that's one. So I'd like to suggest that we find a meeting place where we can go longer without worrying about security, or that we allocate some funds for additional security if that is the reason why we're forced to be out of here at 9 o'clock. There has to be a solution to this problem, because it forced the chair to speed up the meeting. And that's not fair to the chair either. The second thing I want, so end of thought. Next thought. The chair mentioned that he has received a couple of names of people who have expressed interest in the board seat that is vacant. I would like to know those people's names so I can visit with them and pump them up. Get them interested. So, Chair, is there a Brown Act? Or
No, there's absolutely none. I will ask, if I could, I'd direct Ms. Wiley to send those comments to you.
Thank you.
Tonight or tomorrow, at the
Sure.
earliest convenience, so you
And
can.
would you like me to name the names that I know of right now?
Certainly, yeah, please.
We have email from Anna Stockel, Chuck Henderson, or is it Hathaway?
Chuck Hathaway?
Chuck Hathaway. And there was some interest from Michael Blaisdell. And I have another lady who's a retired PG&E gal who lives in Cleon. Her, oh, shoot,
So if you could
I will
give
get
me
you the list, yes.
the data, I would appreciate it.
you bet.
Maybe you can get to all of us. And
That's fine, yeah, absolutely.
Thank
There's
you.
just, yeah. Director Savage?
And I think this is a related comment. What I would really like to have us do, and I'm not sure in what format, is that an agenda item where we as a board can talk about how we as a board would like these meetings to flow in terms of whether it's required or not, how we would like public comment to happen, or any of the other proceedings, rather than it feeling that it's one person that's making the decision. And I don't think necessarily that's the case, but I just think it would be healthy to have a board discussion so that it's the board that has decided how we want these meetings to go, so that everybody feels heard.
Okay. Okay, so
And you
what,
can up to, you know, if you want that to be an agenda item, is that a separate workshop? Is that but soon, so that we can have some clarity for the public?
okay, what I would suggest to you, if it makes sense, is that we're policy, right? So if we can have an ad hoc and then float some ideas to the board, is that? Or do you want to do more formally, do a workshop, which we have to bring everybody
I
together?
would like to have a conversation, and if what makes the most sense to you is to have a presentation or a initial proposal from an ad hoc committee that then becomes open discussion
Yeah,
with
that's-
all
that's
members
what
of
I'm
the board,
thinking.
that could be one way. Or, I'm not sure it needs an ad hoc committee to be able to discuss what we want these meetings to look and feel like. But I wouldn't mind having an ad hoc committee injected in that. I'm just not sure that I see that it's necessary, but I would yield to.
Yeah, tell me how you best think we should proceed.
As soon as possible, what makes sense to me to be the easiest, fastest, quickest is to put it on an agenda for us, early in a meeting, that effective immediately, this is how we would like these meetings to flow, in terms of how we deal with
Okay.
public comment,
Okay.
how we deal with timing, how we deal with any of the various things that have come before us in terms of process procedure, so that it's the board that is together deciding how we want these meetings to
Okay,
go.
okay, fine. So we'll agendize that for next meeting.
Can I make one more comment?
Absolutely, Director Hanson.
Guys, amazing. You've lived through this. You are to be commended. Marshall, how do you do it with these guys? What have you said to them? Have you threatened them? Thank you very much for
This
your
is
time.
OJT.
We
On-the-job
really
training.
appreciate it.
What he does is he brings them lots of snacks.
Yeah. Thank you, everybody.
Okay. Okay,
Good night, Wayne.
okay, if there are no more comments from the board, then let's entertain a motion to adjourn.
I move that we adjourn at 9:50.
8:50, right?
8:50.
8:50.
Yeah.
Oh, whoa.
I second the motion.
Okay, all in
And Paul?
favor?
Aye.
Oh, God, I'm sorry. We have to roll call that. I keep forgetting.
Okay. Paul Katzif.
Aye. Yes.
Susan Savage, yes. Sarah.
Yes.
Paul Garza.
Yes.
We are adjourned.
Hey,
Thank
look,
you.
everybody, I harvested my yellow irises, and I brought a bunch of packets of yellow iris starts, and if you
the name
plant them
tag.
now, they'll be beautiful. So
Yeah.
if anybody wants any,
Oh,
please let me know, they're right here.